Hello guys, how are you? Hope so you are doing well. I am Dr. Devyani from Dr.dentico and today we are going to discuss topic of basic principles for management of maxillofacial injury. So before going to main topic, I just want to highlight some things related to how you will going to diagnose and how you will going to take case history of maxillofacial injury as patient. So first thing we will start with case history. So for history taking, you have to ask mainly 5 questions to patient. Which 5 questions? The first one is what is this? Second is how it occurs. The third one is where it occurs. The fourth one is when it occurs. And the fifth one is protection, which is used by patient to protect themselves from injury. So in first one, what is this? Means we have to ask patient, is it injury or is it anything else? Then second is how it occurs, because there are many kind of injuries like patient just fall from stairs, or it can be road accident, or it can be fight, or it can be occupational hazard, right? So we have to ask how it occurs, then where it occurs, the location, then when it occurs. We should know proper time when it occurs, because based on this we are going to treat our patient, right? Then fifth one is protection used by patient. So sometimes what happens that patient use something to protect themselves from injury, which is more harmful than injury, right? So we have to ask this as well. Like in road accident, we should ask patient, do you have used your seat belt or any protection other than this? So this is 5 questions. Okay, now moving to a main topic, which is basic principles for management of maxillofacial injury. So first we will start with introduction. Now what happened that before this basic principle were introduced in oral surgery, different methods were used by different doctors. So there was no proper protocol which they have to follow, or any specific principles were not there. So however, during these times what happened that in World War situation, mass casualties come to clinic in hospital. So at that time they realized that there should be protocols or methods or any principles to follow. So that's when this basic principle came into oral surgery and as well as any other surgical department, because it is a very common approach that can be followed in any surgical procedure. So there are various methods for handling these mass casualties, and one of the most popular option which is followed by each and every trauma center is a triage. Okay, it is a triage. So in triage, we have to divide patients according to their need. Okay, so we have color codes in triage. So in this triage, we are using 4 colors. Which 4 colors? Red, yellow, green and black. So in red, we will patient who are in red is who needs immediate treatment. Okay, मतलब अगर आप इनको immediate treatment नहीं दोगे तो it can be possible they will not survive. So immediate treatment needed. So like patient with, for example, patient with airway management, I mean airway obstruction patient, and patient with external hemorrhage, right? So in this situation we have to give them immediate treatment. Then we have a yellow category. So group of patient who need delayed treatment, मतलब लगी है चोट कुछ ज़्यादा ही है, ट्रीटमेंट भी चाहिए होगा लेकिन डिले होगा तो चलेगा. फॉर एग्जाम्पल मैंडिबुलर ट्रोमा, I mean sorry, mandibular fracture. Okay, so in this group we have to go for yellow. Okay, then we have a green color. Okay, so in green minimal treatment group, थोड़ी सी चोट लगी है, बैंडेज लगा दोगे तो ठीक हो जाएगी. ओके, सो दिस पेशेंट्स जस्ट हैव सॉफ्ट टिश्यू इंजरी एंड माइनर वुंड. ओके, so these are in green category. Then the black, patient is already died, patient is not survived to injury. Okay, so in died patient we should not waste our much time on this patient, because we have another patient group who really needs care, who really needs treatment, right? Now moving to fundamental principles of treatment with sound surgical basis should be always followed. This principle should be always followed by each and every doctor. So what are this? First is diagnose the patient. In any kind of injury, we have to make a correct diagnosis. For correct diagnosis, first thing is thorough assessment of patient, right? So in diagnose the patient, we have to go for thorough assessment of patient. Thorough assessment. So in this, what kind of injury is there, how much injury is there, what kind of wounds are there. So this is first principle. Then in second principle is to recognize any life threatening situation is there or not. So second is life threatening situation, like BP is dropping, pulse is very weak or poor, any CNS injury is there or not, any CVS injury is there or not. If any kind of life threatening situation is present, we have to appoint a specialist, right, for this kind of patient. So third principle is appoint a specialist who can give best treatment or give cure to this patient. Now after this, in facial trauma, as we know, the function is very much important than the aesthetics, right? So we can understand that aesthetic is the main thing in face, but function should be coming first, because function, like the repair of any kind of injury, is more important than aesthetics. Whenever we are going to perform any surgery on facial part, yes, we will think about aesthetics as well. Like before putting any incision or any flap in facial area, we will think once that is this aesthetic for patient or not. So we will think that. Then if any minor facial injury is present there, so if doctor is going to treat it or not treat it. If minor facial injury is treated, then no secondary procedures is required, right? No prolonged hospitalization, no disability, no expenses, because we have to think all those approaches, all those things what patient can think, right? Because we have to think about patient's economical side as well. So if we have to go for treatment of any minor facial injury at that time only, right? Then if it is not treated, then what happen? It will impact to psychology of patient, like, oh, I'm looking so ugly after this injury. So not treated, psychologically impact. Then severe deformity can occur, like any major thing can occur from minor injury, right? So we have to go for treatment of this minor facial injury as well. Okay, general care of injured patient, like what you are going to do from first to last step whenever severe maxillofacial injured patient come to your hospital. Okay, so first you have to do is complete evaluation. Okay, first step is complete evaluation. In this you have to see how much injury is there, what kind of injury is there any severity or not, right? Then you have to see if any emergency treatment is needed or not. If there is presence of emergency situation, like patient is in shock or it is severe hemorrhage or any spinal cord injury is there or not, right? So in this we have to go for emergency care, because this is very severe thing. So after doing this systemic examination, I mean evaluation, plus you have done emergency treatment and all, so after this now you have to go for facial evaluation. Okay, because facial injury is not a big thing. So after this facial evaluation, in facial evaluation you have to see how much soft tissue injury is there any fracture or not. So in 4 to 6 hours of injury, it's 6 to 8 hours in injury, you have to go for soft tissue injury treatment. Okay, simultaneously you have to treat a fracture with immobilization or any other thing. Okay, so treat a fracture. So this was about general evaluation. Now our main topic, which is basic principles. So in basic principles, these 3 principles every doctor have to follow. So first is preservation of life, right? Because life is a very, very, very much precious thing for doctor as well as patient. Then maintenance of function. Then third thing is restoration of appearance, we can say aesthetics. Okay, so first is preservation of life. So for preservation of life we have a ABCD. Okay, ABCD, this is basic ABCD. A is for airway maintenance, then B for bleeding control, or we can say hemorrhage control. Then C is circulatory system should be restored, so C is for circulatory system. Then D is disability protection, so we have to check that patient should not be disabled or any death kind of situation should not be there. Okay, this is our main goal. So this is basic ABCD for preservation of life. So first is maintenance of patency of airway, right? It means airway maintenance, what I have told you. So in airway maintenance, this is our priority consideration. Why? Because anyone who want to live, they need oxygen, right? So adequate oxygenation is a first priority, so it is a vital to life, right? So this maintenance is depend on four things. Which kind of four things? The first one is absence of anatomical or mechanical barrier. Okay, so we have to remove this barrier to provide a proper ventilation. Then second is preservation of laryngeal reflex. Preservation of laryngeal reflex. Then the third thing is existence of adequate pulmonary ventilation. And the fourth thing is integrity of respiratory centers. Okay, these are the four things, okay, on which maintenance is based on. After this, now we will move to the clinical signs and symptoms of respiratory distress or obstruction. So how you can see, yes, patient is suffering from respiratory distress or obstruction. So what are signs? Signs what doctor can observe. Okay, it means we can observe. Then what are symptoms? That patient will feel and tell you. These are called symptoms. So what are this? First is restlessness, apprehension, anxiety. So if patient is not able to breathe, then obviously there will be anxiety, apprehension, restlessness, right? Then tachypnea will be there, tachycardia, pallor will be there, because proper oxygen is not going to in all the cells of body. Then rapid labored breathing, it means gasping of for breathe, वो तड़प रहा है breathe के लिए. Then rapid movement or fluttering of ala of nose. Then decreased ventilatory excursions, hypercarbia, hypertension, progressive cyanosis if hemoglobin is less than 5 gram. Okay, so these are all the clinical signs and symptoms. Now moving to causes for obstruction. What are the causes, which is most common causes we are going to cover? So first is vomit. Now suppose injury just happened and at that time patient will start to vomit. So this vomit is going to collect in his oral cavity, right? So this vomit will going to block the trachea, so that patient is not able to breathe. So this is the cause. Then second is blood clot. Whenever injury occur, that bleeding start and now this bleeding has stopped, मतलब clot हो गया है वहाँ पे. So this blood clot will going to block trachea, right? Then fallback of tongue because of any middle third facial fractures, multiple bone fracture has occurred. So at that time some pressure is on tongue, so tongue will fall back and block the trachea. Other than this, saliva can be reason, thick mucus can be reason, or portion of teeth or bone or denture. Okay, these are the reason for obstruction. Okay, now how you will going to treat this airway maintenance, how you will be deal with this patient? So there are two options. One is non-surgical, another one is surgical. So we will start with non-surgical, and obviously non-surgical is best method than surgical because preservation is a key, right? So we should not go for incision or flap or anything. So first we will try with non-surgical. So non-surgical, the first thing is patient positioning. So position the patient in a way that does not cause obstruction. For example, place the patient in a supine position with neck extended or head turned sideways. Suppose this is a bed and you have to position a patient with a supine position with a neck extended, or you can give a position of patient from the sideways. So whatever is there in oral cavity, it will come out from the side. Or we can give a position to patient, a prone position with head down. So whatever collection is there, it can be thrown out instead of aspiration. Okay. So after this, you have to, if it is not done by patient position, then you have to go for oropharyngeal toilet. Okay, so this can be accomplished by using your fingers. Okay, it means digital exploration, or by a cotton swab. You have to just clean that area, okay, to prevent a obstruction. Then you can just easily suction all those things. Or we can go for anterior traction of tongue. Okay, so to provide anterior traction to the tongue, to hold it in a proper position, this can be achieved by pulling the tongue. We have to first give proper position of patient, and now we have to pull the tongue. Okay, so pulling the tongue outwards and securing it with a suture. Okay, tongue suture. Now immediate restoration of position of soft palate. So to give proper position to soft palate, we have to disimpact a maxillary fracture. So for disimpaction, we have to place our index finger and middle fingers to soft palate, hooking behind soft palate. Okay, how? Suppose this is your palate, this is your soft palate. You have to just place your index finger, sorry for color, index finger and middle finger like this, okay, to hooking behind soft palate, and your thumb should be on alveolus region of incisor, and your two fingers should be out from the mouth. So this is like that. You have to position your hand in like this thing. Then head should be stabilized by counter pressure with other hand over forehead, right? After this, you have to give strong anterior and downward traction, which will bring maxilla on normal position. Okay, once this maxilla come into normal position, then you have to insert one or two well lubricated nasopharyngeal tubes, okay, to maintain airway. Now, if there is an unfavorable mandibular fracture, it should be reduced first. Okay, then temporary stabilization should be done with dental wiring to prevent further movement. Other than this, you can go for mouth to mouth breathing or oronasopharyngeal airways or endotracheal intubation. Now surgical, we have to go for surgical in extensive maxillofacial injury cases. So in this we have to go for tracheostomy. So in tracheostomy we have some indications, like first is lack of tongue control. If patient cannot control his tongue, then we have to go for surgical thing. So lack of tongue control, then gross retroposition of middle third of facial skeleton, or edema of pharynx, or we can say glossitis. Any respiratory inadequacy is there, respiratory inadequacy. In this situation, we have to go for tracheostomy. So what we are going to do in tracheostomy, we will just I will draw, one second. Suppose this is your neck, okay, and in this we have our trachea. So this is your trachea and this is covered by a skin, right? So we have to just place an incision over it. One second. This is your skin coverage, okay. So we have to just place an incision over it, right? Then we will just flap, we will just raise a flap, okay. So by raising this flap, now your trachea is visible to you, right? So this will be your trachea. So now you have to just make a hole here, okay. In this hole you have to pass a needle or tracheostomy tube. What gauge needle you have to pass? 12 or 14, okay. Then you have to pass a tracheostomy tube over it to maintain a proper airway. In this picture you can see here we have a trachea, and we will just make a hole here and pass a tracheostomy tube, okay. So this is called a tracheostomy. Now moving to a bleeding control or hemorrhage control. So in this is a very must thing, okay. So for this we can go for initial digital compression to stop bleeding, right? We have to just compress by our fingers to stop a bleeding, and also we can go for compression dressing if necessary. Then we can ligate major blood vessel, we can suture of deep and extensive soft tissue wounds, we can go for packing of deep wounds by ribbon gauge piece which is already soaked in 1 gem 1000 adrenaline. As adrenaline has property of vasoconstriction, it will help us to stop bleeding. Now moving to C, which is consciousness restoration or circulation maintenance. So it involves assessing whether the loss of consciousness is due to intracranial injuries or due to hemorrhagic or neurogenic shock. So if it is because of intracranial injury, we have to go for surgical way. If it is because of hemorrhagic or neurogenic shock, we have to go for IV fluid, okay. IV fluid should be started to restore blood volume, and also we can go for blood transfusion if very much blood is lost during injury. Then we have to check pulse, respiration and blood pressure. Then we have to relieve pain of patient by giving analgesics, right, making patient comfortable. Gentle handling and compression dressing we have to do, and simultaneously we have to go for splinting of fracture as well. Then control infection and inflammation by antibiotics and anti-inflammatory drugs by IV route, okay. Then anti-tetanus injection we have to do. Then we have to take proper care of nutrition of patient. So if patient is not able to chew from oral cavity, we have to insert nasogastric tube. Then supplementary vitamins can be given, right? So this was all about basic principles for management of maxillofacial injuries or trauma. So thank you so much for watching this video. If you have any doubt, please leave a comment and I will be sure to respond. Have a nice day. Thank you.